going to be about cervical cancer prevention in the US. And we're so excited to have Dr. Mona Lisa Chandra, who is a social and behavioral science researcher in cancer health disparities. She has PhD in behavioral sciences from University of Texas School of Public Health and is currently a postdoctoral fellow at MD Anderson Cancer Center. This is so exciting. How long have you been doing this work?
Cervical cancer research, directly, indirectly, I've started from 2018.
Okay.
And before we get into the content, I would like to thank for inviting me for this very important topic. And this is a Cervical Cancer Awareness Month, and we have a lot to accomplish in the state of Texas, in United States, worldwide as well. So thank you for this opportunity. So yeah, coming back to my research, so I have been working on cervical cancer research pretty much from 2018, but publications were recent, and now I have put my full focus on this topic, particularly on HPV vaccination, cervical cancer screening, with a special focus on the Asian American population because the disparity is very high in our population.
Really?
So yeah, it's been a fun journey, and the other thing which I, as a social behavioral researcher, social determinants of health has always been one of the very key interesting factors for me. How the multiple layers of individual, society, community, or network, ultimately has an influence on what health decision you take.
Yeah.
So that's where this particular disease, cancer in general, but cervical cancer particularly, highlights the inequity in women worldwide, and we have seen a direct relationship between inequity and cervical cancer outcomes. So that I find that very fascinating, and hence, my journey continues.
That's amazing. Okay, so what is cervical cancer?
So, any individual with cervix are at risk to this cancer, which is caused by a virus called human papilloma virus. Cervical cancer is a cancer which starts in the cells of the cervix. Right? So that's what we define as cervical cancer. It can start at different places in cervix, but it's basically cancer that starts in the cells of the cervix. And it's usually a very slow development, and majority of cervical cancers are caused by human papilloma virus, HPV. And the interesting thing is, it's a very common infection, HPV, which people don't really understand. And studies suggest that 80% of sexually active individual will contract this virus whatsoever. But our body is a unique machine or mechanism, as you may. We get to wash it off through our immunity. So cervical cancer or other HPV-related cancers occur only after chronic exposure of HPV. Right?
Yeah.
So just to let you know, HPV causes 6 types of cancer so far detected. I'm sure there will be more I hope not. So cervical cancer is one of them. And then we have penile cancer, other genitalia cancer, anal cancer, and all of them are caused by the specific virus mostly. And it takes time for this. Either it's going to be washed away through our own immunity, or because of certain risk factors, some people are prone to get this infection. But from infection to cancer, it takes around 10 to 15 years, on average maybe 20 years. So you have a long incubation period where you can actually do things to prevent it from becoming a cancer. So unlike many other cancers, we have a couple tools in this one where we can identify it as a precancerous stage, and that's why we can say we can prevent cervical cancer. Unlike many other cancers where prevention is not necessarily always possible, it's mostly early detection. As an example would be breast cancer, right? Which reduces the invasive procedure and the toxicity associated with the cancer treatment. But cervical cancer is one of them where you could actually prevent. So the cells first get infected. Chronic exposure leads to precancerous cells. if we can identify at that stage, then you can reduce the you can actually prevent that from morphing into cancerous cells and prevent the whole cancer experience of that individual.
Oh, wow. Okay. But so what is human papilloma virus?
So HPV, or human papilloma virus, it's a virus that we are kind of familiar, especially after COVID. I'm sure everybody has some knowledge of virology or so.
Yeah.
So this is one of the virus which is so far what we have seen is transmitted either between individuals or through inoculation. So there are multiple methods through which we have seen HPV virus being transmitted. And this virus is responsible for 6 kinds of cancer, as I mentioned, cervical cancer, other genitalia cancers, and oropharyngeal cancer, means the back of the throat cancer, which has not been identified very long back. This association between HPV causing oropharyngeal cancer, it's been a couple of decades, I would say, less than a couple of decades actually, and this association, but we are seeing a rise in oropharyngeal cancer in the last 2 decades in the US. So as a matter of fact, another interesting fact is earlier, among all HPV-related cancers, cervical cancer used to be the highest in terms of number of sites, but now oropharyngeal cancer has taken over.
Oh.
So now, and this is US data I'm talking about.
Okay.
But HPV causes cervical cancer, and I say there's a stage of development how the cancer happens with HPV infection. Having said that, only high-risk HPV can cause cancer. There are 200 strains of HPV, out of which there are low risk, and there are 12 high-risk strains, and out of which primarily 2 types of HPV, HPV 16 and 18, are identified with most of the HPV-related cancers. So, again, going back to the discussion, so HPV is, in case of cervical cancer or other HPV-related cancer, we have seen multiple pathways for transmission. Mostly, if you generalize it, one term would be intimate skin-to-skin transfer, right?
Okay.
So it could be auto-inoculation within one host, and it could be transmission between individuals, what we call as inter-individual transmission, which can be perinatal transmissions, mean mother to child during delivery.
Okay.
If mother's infected through vaginal exposure, the child can get infected. Sexual transmission, then other things like deep kissing and indirect transmission through contact with hands. So these are the now. Having said that, there are other risk factors that why would somebody be infected by HPV. One is low immunity. Women who or men who have been exposed to HIV before has higher risk of contracting HPV. Then early onset of sex life, having multiple partners, having a partner with previous HPV infection, multiparity means having multiple children, right? Starting from very early. So early full-term pregnancy, that one was pregnant before 20 years of age, had a full-term pregnancy. Then smoking. Actually, this awareness is not there as much. The smoking actually increases the risk of cervical cancer. It has very good association. Then the other thing is, which we have some data on, that long-term usage of contraceptives have some risk of contracting HPV. Now, all these female reproductive organs associated with risks are often, it's not very clearly found. There's no causal pathway. Why is it actually happening? But we do see an association for these kind of body types. We are seeing this kind of cancers, right? So it could be because of the hormonal changes, or during pregnancy, or excessive number of pregnancies, lack of growth in the body, things like that. So that's why one of the reasons you see a lot of cervical cancer cases. Global burden of cervical cancers is primarily Sub-Saharan Africa, Southeast, South Asia, and Central America. So that's where I come back to the conversation: inequity, access to healthcare, low socioeconomic value of women, high fertility, early fertility, early reproduction or child delivery. So these factors then come together is increasing the risk of cervical cancer, and we do see a lot of high incidence and high mortality in those regions, right?
Actually, here's my question. You said sub-Saharan, which makes sense because they are poor, and then of course Southeast Asia because they don't have resources. But why Central America?
Central American, many states are not. We call that middle-income countries.
States.
So what, in general, the global burden, as we define in terms of cervical cancer space, is in the low-income countries and middle-income countries. Yeah.
Okay. So that's why.
That's one of the reasons. Having said that, I mean, I would say United States may not be in the red flag as a national average, but cancer is a disease which doesn't discriminate based on what you have, where which socioeconomic status or which gender you are, or what kind of privilege you were born with. Yes, with those you do have more access to treatment, screening, and things like that. But when it happens, it can happen to anybody. So, yeah.
Okay. So, how do we prevent this cervical cancer?
So that's the blessing of living in a developed nation, I would say. We have the tools of preventing cervical cancer. So there are two mechanisms right now. One is HPV vaccination, and the other is cervical cancer screening. There are very few vaccines, literally 2 vaccines out in the world, which can prevent cancers. And people are working on using vaccines for therapeutic purposes. I mean, at MD Anderson also a lot of people are working on it. But to prevent a vaccine that's out in the market, tested and proven safe for 20 plus years, there are only 2. One is HPV, another is Hep B, hepatitis B. Right? So I think that's a huge blessing, because taking one vaccine can prevent 6 types of cancer from an individual body for pretty much lifetime. We have immunogenesis data has shown strong immunity even for years after taking the vaccine, right? So first I will talk about the screening, and then I'll go to the vaccine discussion. So for cervical cancer screening, we called it secondary prevention, because that is, you can screen cervical cancer only when you are already exposed to HPV, right? So that's why secondary. So when we have chronic exposure to HPV, the cervix structure changes, or the look of the cervix changes, right? So with that said, in US we have 2 tools. Actually, we'll come up with 3 tools very soon. 2 tools. One is Pap test, another is HPV test, right? So women who are 21 to 64 years old, according to our USPSTF guideline, United States Task Force, which creates the major guidelines for all insurance companies and doctors and things like that. Women within the age of 21 to 65 should take a Pap test, which is basically, you need to go to the doctor. I mean, most of us have heard of it, I'm sure. They gather a sample through a brush, and then they send it to the lab to test for any abnormality in the cells that they found, right? So if you find any abnormality which is still not cancerous, we call it at a precancerous stage, then there are some procedures which are done to the cervix and in general, which takes care of it being transitioned into cancer. And then if you have cancer, then you have to go through the cancer treatment, right? And that's Pap test. And then we have HPV test. And Pap test needs to be done every 3 years, while HPV test is done every 5 years, right? Recently, USPSTF have changed the guidelines, and they said that just doing HPV test every 5 years is good enough. So that reduces the hassle of doing Pap test every year. Every 3rd year is, I think that's a good idea. And now, last year has been very much happening in the space of cervical cancer, One, in terms of research, we found some amazing outcome of the combination of HPV vaccine and screening has been done consistently for last, say, I would say, 1 decade or 2 decades. But we also got a new tool approved by FDA, which is a self-sampling HPV test, which rest of the world has been using.
Okay.
For some reason, we decided to delay on it and get more data and evidence. It is basically, FDA has approved that in presence of a physician, the woman can take her own sample and that can be assessed for the lab.
So instead of the HPV? I mean, instead of the pap smear?
test, yes. It is kind of you're doing your own pap test. In Australia or Europe, you can do it at home. So far, we have been given permission to do it in the clinic. I think it's sort of the education purpose also to teach the women how to get their own cervical sample and all that. But I'm very excited about it because that opens up the whole. It's a game changer for culturally conservative communities in US, right? Because many women, I mean, honestly speaking, if you ask me, I am not comfortable having that speculum inside myself. Sorry, it's
That's
cold
the most
and it's
uncomfortable
most
test.
yeah, exactly. And I heard this from most of the women that I've talked about in terms of research or whatsoever.
Absolutely.
So if you can do it yourself
But
at
then
your
it-
own
and
privacy.
I'm just saying this as a woman who does the pap smear test. Like I think I would be more uncomfortable doing it myself in front of someone else. Like I'd rather just have the doctor do it.
That's true. That
Experts.
you're inconfident, not uncomfortable.
Yeah.
Inconfidence
Yeah,
comes
true.
with the lack of education.
Yeah.
That's why I think they want to do it in front of the doctor so that
So they can
initial
educate.
phase, when until and unless we know the population knows
Yeah.
how to do it, you do it in front of the doctor and then they can tell you exactly what to do. But having said that, what we are seeing in many of our data that came out of many other places, including MD Anderson, that people are getting more and more confident using it. And come on, rest of the world Australia has been using self-sampling for many years.
Yeah.
So did
Yeah.
Europe. I mean, we are all
Yeah.
23 plus genes. I mean, I don't think there is any difference in US women versus Australia.
No,
So
I guess it's about
yes,
education.
yes, it's a gradual process of developing the self-efficacy of doing the test, I guess.
Right.
But I think that is going to be a game changer because, again, first of all, you need to go to a clinic to do that because, our annual checkup and well women are not done on the same days,
Yeah.
correct? We always have 2 different appointments, which means it will cut down 1 appointment.
Right.
I mean, there are a lot of barriers in terms of getting checkups, getting your annual screening, which is significantly always low among the conservative communities. So I think that's going to open up a lot of things, especially among the immigrant communities. See, I can tell you when I was growing up in India, there was no conversation of cervical cancer in the radio or TV or wherever, right? And now they're talking about it because it's a talked about, like WHO has taken up this whole stand on eliminating cervical
That's what
cancer.
I've heard it on TV. That's
Right.
what I remember HPV, because they have ads going on.
That's
about
right.
it.
That's
Yeah.
right. They have a
Yeah.
lot of work going on now in
Yeah.
that social marketing space to improve this situation. But if I was not in this research or I was not involved with patients through my non-profit services, I would not have known about the depth of this disease or how vulnerable I can be. Correct. So that kind of gave me this, this whole idea that we need to bring this discussion to the parents who have come over from different countries where this discussion was not there growing up. So they did not come with this knowledge over here. And now, if you are not until 21, you don't even know that you need to get screened. And when you come to this country, trying to set up your roots, trying to set it up your life to begin with, your self-care is the last priority.
Yeah, that's true.
Right? That's a reality of our lives, right?
Yes.
So having that information out and about in the community in a culturally tailored way, I think that has a huge impact in improving health outcomes. So that's one of my goals, trying to bring it to the community, bring it to the conservative communities or newer immigrant communities who may not have access to this information easily. So, so so that's why I'm excited about the third option. If you can do it at home, if it's a mail-based thing. So the mail-based testing would be you register online. They're going to send you the kit, take the test, seal the loop, send it back by post, everything prepaid, and it get tested and then tell you where you are in terms of your thing. So that reduces a lot of barriers and increase the HPV test uptake quite a bit. So when that happens, I think it will be very interesting. I'm sure it will take at least 5 to 10 years to come to that level. But we are still struggling to get what tools we have right now to have a optimal uptake. So just to give you a scenario, right now, screening PAP test as well as HPV test is low in US in general, though from 1970s to now, obviously it has increased. And we have seen the reflection in terms of incidence as well as mortality. Recently, Dr. Ashish Deshmukh from Medical University of South Carolina, he published a very nice paper where he has been able to show that women less than 25 years, the cervical cancer mortality has gone down. And his speculation is that's a combination of screening and vaccination, primarily vaccination, because you can only start screening after 21, right? So we are seeing the effect of HPV vaccination in one cohort for sure. And now the cohort, the age cohort which is more susceptible is 30 to 49 years to this cancer level. When we can see that data, and which will come in maybe next 10, 15 years, that will really show us what vaccine can do. I mean, I'm sure very few people will disagree that vaccine is one of the most novel inventions in modern medical science. And since 1800s till now, we have been significantly able to reduce infant mortality, maternal mortality, all sorts of mortalities to begin with. I mean, this is an amazing tool. So, we are seeing the outcome of that result. Now, I'll come to the HPV vaccination, and please feel free to ask any question if you can. I'm just talking by hand. So now coming to HPV vaccination. This vaccine, it's been almost 20 years that they have had data. They're still, observing it to make sure things are going right. And there have not been any concerns. It has been proved safe and all of that. And almost 150 million doses have been out with no alerting cases directly linked to the vaccine. So the vaccine is the primary prevention to this disease. So if we are capable of inoculating our population with this vaccine, we can, if not eliminate, almost remove it to the greater extent that we see the pervasiveness. But unfortunately, HPV vaccine uptake is pretty low. In US, after 20 years, right now we are looking at 78.5-ish for the vaccine eligible kids and individuals. And having said that, I want to give some guidelines on who can take the vaccine and all that. So HPV vaccine is recommended, routine HPV vaccine is recommended from 9 years to 26 years. So if you take within 9 to 15 years, before 15th year, it's only 2 dosage. And after 15 year to 26 years, it's 3 dosage. So which means you complete the series. Like you have one initial vaccine and then you have boosters. Just to give the idea. So we have, even among young adults, there is opportunity to vaccinate them, right? So but the doctors always recommend vaccinating early for 2 reasons. One is to protect the individual body before exposure chances happens, and second is at the 9-year age, you get a lot of vaccines at that time. From 9 through I think 15 or 16, there's a huge gap in terms of what vaccines you need to take and all that. And what we have seen in data, the annual checkup for adolescents go down quite a bit during that phase. So at 9-year-old, if you can have that vaccine with rest of other Tdap and all that stuff, just get it done with.
Yeah.
You know, you don't have to worry about it. 6 months later, take the next booster, you're good to go for rest of the life.
Right.
So that's why one of the reasons American Cancer Society and other organizations are promoting 9-year as a starting thing. So yeah, so that's why. But having said that, in Texas, what we see right now, the HPV vaccination uptake among 13 to 17 years old is 58.6, which is even lower than national average at that age group. So we need to take more actions. I mean, vaccine uptake has increased, but we need to take more proactive actions and address to misinformations, reach out to more communities with the information, because my community work, what I have seen, many parents did not even know this vaccine existed. So you don't know what you don't know, right? So so bringing this information to the communities, talking about it, like your platform is a great opportunity, reaching out to so many people and understanding what the vaccine can do, right? Yeah.
We're gonna take a quick break and we're gonna be right back with this interesting conversation.
Thank
Welcome, Houston, to sorry, I'm so lost with this conversation. So welcome back. We are talking about cervical cancer prevention, and here's a question I had for you. So, like, I'm just talking about it as a mother, right? So when I go to the doctor's office, like, they recommend all these vaccines, and I mean, I just say yes to them. But like, so what happens at, like you said, ours is like around 58% in Texas. So this group, do they not have access to healthcare, or, you know, like, why is the number low?
58.6% is the average, and I have not even disaggregated it by healthcare access and things like that. So there are multiple factors which leads to low vaccination, particularly HPV vaccination in Texas. HPV vaccine in Texas is not mandated, unlike many other states. And just to let you know, Texas stands like 47th out of 50 states in terms of uptake.
Okay.
So since it's not mandated, people feel, okay, it's not mandated, why do I put another vaccine in my child's body, right?
Yeah.
Schools doesn't mandate it. It was mandated briefly during Governor Perry's regime, but then it has been reversed, so policies have changed after that. So since it's not mandated, parents don't feel like, and there are evidences where doctors don't recommend,
Okay.
unless parents ask for, right?
Okay.
So the combination of multiple things, lack of access, fear of stigma from the patients, that fear of being judged from the patients, and then providers not recommending the vaccine has led to this low uptake. We have this policy in Texas, or the perspective on HPV vaccine in Texas has been more on the conservative side, or more on the skeptic side, I would say. And so that's why it becomes more and more important that we reach out and educate the providers, educate the community, and make them understand the need of this vaccine. So I strongly believe with good education, good scientific education, of what's with the data that's available around, we parents will make the right decision for their children.
Right.
I mean, it's important to make that sound decision based on information, scientific information, right?
Yeah.
So that's one of the primary reasons in Texas that we have found. For example, I actually published one article in JNCI Cancer Spectrum, and where we found that religiosity has a direct relationship with HPV vaccine uptake, and we did a multi-level study on that. At state level, what we found that teens who live in religious states tend to take there's uptake of HPV vaccine among those teens are lower. Those who are living in the religious state, highly religious or even moderately religious states. So religiosity is a factor from parental side to make that decision. But again, having said that, this is something I strongly believe. No religion in the world has prohibited from community health. No religion in the world would say that if this does good to my child, you should not give it to the child. So again, I'm not a theologist, but as a mother of 2 boys, and as a responsible citizen, I feel it is just not to protect my children, because vaccines don't work unless you inoculate the population. It is also my responsibility that I be part of that community who is vaccinated, so that the whole community is protected.
Yeah.
Right?
Yeah.
So,
So what are some misconceptions about, like, why are people hesitant to take it?
the main misconception that we found as researchers in Texas, a lot about safety.
Okay.
Parents are concerned about how good this vaccine is, what does it do. HPV vaccine at the end of the day is cancer prevention, right?
Yeah.
So I'm sure any parent would want to give this as a gift to their children, preventing 6 cancers from rest of their life. But the fear comes in, what happens to this if I take this vaccine. Again, there are a lot of misinformation out in social media and different other medias about side effects of the vaccine. I can tell you there is no evidence found so far worldwide that HPV vaccine directly has caused any kind of serious disease. For an average risk individual, means people like you and me who don't have like severe health conditions, HPV vaccine has average risk outcome, like slight fever, pain in the arm, like any other vaccines, correct? So that's one of the fear in the parent population. And the other thing is, which I have found a lot, unfortunately, that has happened to this vaccine, is because the HPV vaccine was associated with cervical cancer, cervix, and found in the HPV 16 was found in anogenital area. This association with sexual transmission has almost killed the mission, right? But having said that, as I mentioned, 80% of sexually active individual will contract this virus some way or the other. It will get washed away, or if the immunity is low, other risk factors comes, chronic exposure happens, then they can get this cancer. So before infection happens, if we can stop it through vaccine, I think that will be the most amazing idea, correct?
Yeah.
So, but the whole messaging kind of got messed up, and I had many kind of comments coming from conservative communities at times, or concerned parents that, is this going to enable more sexual promiscuity in my children? I mean, seriously, sexually transmitted disease is just not caused by HPV. There are multiple viruses, multiple other bacteria which are linked to the sexually transmitted diseases. So nobody in the scientific community is promoting sexual promiscuity through this vaccine.
Right.
This vaccine doesn't promote sexual promiscuity by any means. It is a protection again anybody, and even in the monogamous relationships we have seen there has been infection, right? And this can cause not only cancer, this also causes other diseases like genital warts, which are very painful. It can cause papillomitis, which is in the lungs, which is also painful. It's not fun living with those kind of diseases as well. Though they're considered low risk, not as high risk as cancer, but there are other diseases that happens to that. So coming back to your point, the prevention part somehow got discussed or less discussed than, and it was sort of the messaging got messed up.
Okay.
So I think instead of focusing on the transmission, I think it's more important to focus on what it can cause, what it can bring to your child, what it can do, how it can help your child. And I think it's an amazing gift, because as we grow more and more towards modernization, there will be chances of cancer happening more with increased stress, with increased environment and environmental toxicities and things like that. So as much as prevention we can take, and I wish we had vaccines for all cancers if possible, but I'm hoping one day it will. But what we have, I think we should consider, at least educate ourselves, then take an informed decision instead of being swayed by social media misinformations and things like that.
So then, what are the benefits of the vaccine? You said it prevents 6 cancers, right? And then
So another factor which people kind of, I'm glad you asked that question. So safety is a concern.
Yeah.
What are the benefits? First of all, it prevents 6 types of cancer.
Yes.
Secondly, it prevents other type of low risk diseases caused by HPV. Thirdly, it actually helps in preventing male and female infertility.
Oh.
So male infertility association was not found until last year. That's why I said last year was very happening in this field. So what we found is males with higher exposure to HPV has sperm shape and sperm size, spermatozoa associated problems. So it affects male infertility. It causes male infertility, and of course with this disease, women can lose their chances of becoming a mother. Because if you have cancer, or if you have even pre-cancer, you have to go through surgeries. Your cervix might be removed. At times you have to have a full hysterectomy. So the ability to be a mother can be taken away. And I have come across survivors as young as a 25-year-old who was diagnosed with cervical cancer and cannot be a mother anymore rest of their life. So that's sad.
Yeah.
And applicable for males, I'm guessing, as well.
Yeah.
So those are the two major benefits of this vaccine, and it prevents you from this kind of diseases.
Yeah. And are there any side effects?
As I said, for average risk individual, there is no noted side effects.
Yeah.
So generally, what they have observed is like pain. Like my own son, when he had his HPV, my younger one, he had like bruise-like pain for almost a week.
Oh, wow.
But I will tolerate almost a week versus rest of the life, right?
Yeah.
So that's the benefit outweighs the pain in many ways. So that's one. Then fever.
But this is not the only vaccine.
No, absolutely.
That causes arm pain.
Absolutely.
Because I remember my son complaining. So yeah, he gets vaccines. So,
Absolutely. So so that's one of the things. Fever, mild fever, dizziness.
Yeah.
And these are the general standard side effects that we have seen. But again, I'm re-emphasizing this fact that talk to your pediatrician, talk to your family physician, because they know the best of your body's son's or daughter's constitution, and they would be able to suggest if it seems risky, right? Yeah. So getting this information, talking to your pediatrician, talking to your family physician, and taking the next step is, I think, very crucial. I missed one point that there's this very interesting confusion about HPV, and that I found in the community quite a bit when I talk to the parents, is, I thought HPV removes only cervical cancer, so I gave it to my daughter, not to my son. But HPV actually equally affects boys too. So as I said, so far we have found evidences in throat, evidences back of the throat, evidences in anogenital area. So men are also affected. And as a matter of fact, oropharyngeal cancer, which I said is on rise, majority of oropharyngeal cancer happens to men.
Oh, okay.
So it's important that you vaccinate both your boy as well as girl child. So, yeah.
Okay. What can be done to promote prevention?
Platforms like this. We have to talk, but evidence-based discussion. Yeah. Not just, and that's the unfortunate part. As much as I am a scientist by training and profession, science can be used in many ways. Right. So we have seen so much information malhandling or twisting using AIs and different mechanism, which sounds very, very authentic, right? And for a lay person who's not educated in the field will easily get confused. So that's why it's important to community leaders to host this kind of discussions. Yeah. And that also helps the scientific community to understand and address the concern the parents have. Right. So that's one of my future research, that I'm particularly working on the South Asian population to understand what are parental concerns and barriers associated with getting this vaccine, and then develop an intervention so that I can address it. Okay. So, information is a power. If we can equip the parents with the right information, then I think that's the beginning of the journey.
Okay.
So I just have a question, Mona Lisa.
Yeah.
You are going out in the community to talk to people, to raise the awareness. How has the response been so far for you on a personal level? Like, do people come to you, ask you more questions? Or, are there any like surprise moments? A lot of parents are not aware. So what kind of reaction do you get when you're out in the community?
I'm very thankful you asked this question. I had very interesting experiences with this because at the end of the day, all the parents want the good of their child, right? So I think my major finding was lack of information. People really didn't know this vaccine existed, or people really didn't know, heard about it, heard good and bad, so were not sure. Now, it's not mandated. Why do I bother? Do you think it's really important? How does it help? And then I had questions associated. I was directly asked, this is about the vaccine which will make my child go into relationship earlier, right? So but again, it's important that people ask these questions for us in the scientific community because we can address with information, right? So one of the way, although using protection does not necessarily completely cover HPV infection, but using protection is something we have been promoting for any sexually transmitted diseases. So as I said, this is not the only sexually transmitted disease. Promiscuity is definitely not part of the intention. So I had multiple kind of questions, but mostly the questions were associated with lack of knowledge. Two things. One is I did not hear about this vaccine. I did not know much about this vaccine, or I gave my girl child but not the boy child because I didn't know it also affects men, right? Because the discourse even still now is a lot about cervical cancer, but the other forms of cancer are not still much in discourse. So I think it's time we start addressing that gap as well. Yeah.
And are there any resources that people can go to? Because, everyone goes to Google, but it's not always correct information. So are there any resources that are available for people to go online that is legit, that can go and get more information on
Absolutely.
HPV?
Absolutely. So if you have access to internet, visit sites like American Cancer Society, hospitals which are dealing with cancer primarily like MD Anderson or Methodist and others who are, you will find scientific information over there. Avoid getting swayed by just information. Do reference checks. Go to the organizations which are known for their scientific endeavors. So that's all I can say. I mean, of course, I'm in no position to direct anybody to look for what kind of information where. But yes, the organizations which are cancer support organization, as I said, ACS is one of them. ACS is very active in promoting countrywide HPV vaccination as well as cervical cancer screening to be in parity with WHO's aim to eliminate cervical cancer worldwide. But so those are the best opportunities. Talk to your doctor. I mean, the doctors are trained on these kind of education yearly almost. So talk to your doctor, ask them question, and if you feel you have enough information, then take that decision. Yeah.
And how can uninsured or underinsured get the HPV vaccine or the screening?
Okay. Yeah. So in Texas we have programs. Actually, nationwide we have programs, and I'll talk about Texas only since we are population that we are addressing. As we have something called Texas Vaccine for Children, which covers for any vaccine. And people who are uninsured will have access to vaccine either low cost or no cost. And these vaccines are, these kind of programs are available in the state or county clinics. So you go and visit those clinics, talk to them whether they have HPV vaccines. And similar clinics have the cervical cancer prevention screening programs.
Yeah.
So Texas has a program for women health under which these screening costs are covered.
Okay.
So so this is how you can get uninsured or underinsured can get hold of these services.
That's great. I mean, I can't believe it's almost end of the show. Thank you so much for being here. Do you have any last words to share with us before?
And I definitely want to thank you, Chai Time, for giving the platform to reaching out to the community and talk about it. And I would like also reach out to other community leaders to take this up as a topic to discuss, host discussion sessions, let people open up their heart, ask any hard questions, soft questions, does not matter, ask questions. So we all want the best of our children, so this is a gift that we can give to them for the rest of their life.
Thank you so much. Thank you, our listeners and our sponsors, and we will see you next Monday, same time, same place. Bye-bye.
Thank you, Laila. Thank you, Milan.